So today's webinar, we are going to talk about navigating the OIG exclusion list and the OIG exclusion program. And I would be quickly talking about the importance of OIG exclusion program and what are the compliance requirements. Sam, please move on to next slides, please. Agenda slides. Yep. So I'll be talking about cover some of the compliance requirement and what are the best practices involved in this OIG exclusion program compliance needs. Next slide, please. Yeah. Thank you. So before we deep dive into the topic, I just want to highlight why this exclusion monitoring is not just a best practice, but a financial and even the regulatory necessity. Why we continue to see significant enforcement actions where organization unknowingly employed or contracted with excluded individuals. So that's the topic for today. And on the slides, you can see some of the enforcement actions, the recent enforcement actions. Like example, this year, a group of skilled nursing facilities has agreed to pay 1.56 million for violating the CMP, that is Civil Monetary Penalties Law, because they employed an excluded individual. So this part of a fraud was this came into picture as a self disclosure, but the financial impact was still massive because it's a huge violation. So another hospital, they have agreed to pay 545,000 for a similar violation. But again, though it is unknowingly employing an excluded individual who was appeared on the OIG exclusion database, but still there was a penalty because of a serious violation. And looking back into last year also, the hospital has paid so much for getting engaged with an excluded party. So this shows why it is so important to be compliant with this OIG exclusion. So most of these organizations believed that they had a proper process in place, but still there was cases uh, everywhere, last year also, this year also, because even the accidental non-compliance can result into this the 6 or 7 figure penalties what you are seeing on the screen. So with this context, I would like to go ahead with the webinar, saying that how the OIG, understanding the OIG exclusion program is crucial. Whoever is participating in Medicare and Medicaid programs or any federal funded programs. Go ahead, next slide, please. Yeah, so we have a small quick poll. Could you please launch the poll? Yeah. How frequently does your organization currently perform this OIG exclusion checks? Do you all aware of it? Is it monthly, quarterly, annually? Or only during onboarding? Yeah, few more seconds. You can conclude. Okay, thank you. So many of you have said it is only during onboarding, and few were unsure and few were quarterly and monthly. But I mean, as I go through this presentation, I will I will make you know what is the best practices in following this exclusion checks. So next slide, please. I'm still seeing the poll. Is that correct? Okay, thank you. So before we go into the details, it's very important to know why this exclusion program exists, right? Because to protect the Medicare, Medicaid, or any other federal funded programs, so this exclusion program exists, and how it protects these federal funded program is by keeping out the individual or even the organization who have committed fraud or abuse or any serious violation in during their services. So in short, I would say it's a safeguard that ensures only trusted eligible people can participate in federal healthcare program. I'm pretty sure you all know what is this exclusion program. So let me directly get into the main purpose of the exclusion program existence. So as you all aware, this program is designed to keep the people out of the federal healthcare programs if they have committed fraud or any serious violation. So thus it stops the bad actors from billing to Medicare or Medicaid programs again. So another important purpose why this program exists is protecting the program integrity. So by removing the high risk individuals and entities, this program keeps the healthcare system clean and very trustworthy. So only safe and compliant providers can take part of it. So it also supports compliance. How? The programs gives a central place to check if someone is allowed to work with federal healthcare programs or not. So thus it helps stay compliant and avoid mistakes. It also promotes transparency and public awareness because this exclusion list are public, so anyone can see who is banned or who is excluded from this program participating in the program. So this creates accountability and also helps to make organization make better hiring and contracting decisions, right? So when you are hiring an employee or making contract with the vendors, you can make right decisions by checking into this exclusion list. So it not only does that, but it also helps you meeting the legal requirements. So screening of this exclusion is a legal requirement for all the healthcare organization whoever participate in this federal funded programs. So lists are always updated regularly. Every month, you can see by 8th of every month, the OIG excluded list will get published, and we must check them often to avoid the penalties or overpayments and any compliance issues. So next slide, please. So I will not go in detail with this slide because we all aware why this exclusion program exists. And one thing it's very important to understand, this exclusion applies only to federal healthcare programs. Okay. So next slide, please. So another important thing we need to understand about the OIG exclusion is that this rule applies no matter who submits the claim. So if an excluded person is involved in any part of the patient care or even administrative work, that means no federal healthcare program can pay for these services. So it does not matter the claim is submitted by a hospital or clinic or billing company or any other provider. If this party is excluded, then even behind the scenes, the service becomes non-billable to these programs. So the message is very clear from this is if an excluded person is involved or party is involved, there can be no federal healthcare program payments. You will not get any payments for those. And the main thing is this list of excluded individual or entities is the main database what get published from OIG, which is in short called LEIE. So this OIG database is the main source for the organizations to check whether someone is someone is excluded from participating in these programs. So this LEI is available on the OIG website. You can go and access it, and you can access in two ways. One is search it online by maybe a person name or the entity name, or that is one way, or otherwise you can download the full data set. That is, the database is publicly available for bulk screening. So, but it's important to check not just the current name. Sometimes what happens is the former names and all you may have to check. So the list is updated regularly, as I mentioned. So every month 8th it will get updated and published. The frequently it gets keep updating. So for as an example, from October last year to till March 31st 2025, the OIG has excluded 1,500 individuals and entities from participating in healthcare program. So imagine 1,500. So this shows how active the exclusion program is and why you need to do regular screening as part of this contract compliance. So LEI is the best place for organization to verify the eligibility and even protect themselves from penalties, overpayment, and compliance issues. Next slide, please. Yep. So one of the most important compliance requirement for any of our healthcare organization is always screen all the vendors and even the potential employees before you hire or before you execute a contract with them. Don't just wait till you hire them and sign the contract. So just before doing all these things, you have to make sure that you verify or you screen all of them with this OIG list. So you should use the LEIE list, current list, whenever you are going to do the screens. The purpose is to make sure we do not even accidentally work with anyone who are excluded, and even unknowingly also you cannot do business with them. So this is why screening has to happen before onboarding itself. It's not enough to check someone after you start hiring and work with them. So you must always confirm that your every employee, whether they are contractors or even clinicians or any third party vendors, are fully eligible to participate in federal programs. Then only you hire them or you execute a contract with them if you are participating. Again, I'll put it in a quote, in Medicare funded programs. So next slide, please. So some of the best practices in this screening of this OIG exclusion is what we are going to discuss. The very first step is always screen before the engagement. The first step is make sure you screen all your vendors, employees, partners, or even contractors before you start working with them. So thus you can prevent the excluded individuals in entering into your system in the first place itself, right? And not just at that place is enough, because after onboarding also you should have ongoing monitoring in place, because it won't stop, the compliance won't stop just after onboarding, but monthly or periodic checks are essential, because new exclusions keep adding all the time from the OIG. So always continuous monitoring helps you catch issues early before even it goes to the worst case, right? And document everything. The documentation is very critical. You need to maintain all the clear records of each and every search. Okay, so always good documentation, I would say, you'll definitely protect the organization when there is some compliance issues. And lastly but not the least, self-report the issues. When I say self-report the issues, if you are, let's say, if while onboarding everything was okay, but over the period of time, if you see the individual or the entities with whom you had a contract, or even your employees are getting into that excluded list, then immediately when you come across, you should do the self disclosure. So there is a link, I will share it at the end of this presentation, where you can even go and do the self disclosure on the OIG portal, so that it shows to the OIG and the regulation that the organization takes compliance seriously. So together with all these four steps, I will form but a simple but very effective workflow for protecting your organization from could be legal, financial, or even the reputational risk. Next slide, please. So let's see what are the consequences if you don't follow this compliance. What would happen if there is a non-compliance for these requirements what I just talked about in the previous slide? So it could be civil monetary penalties. The organization can face large financial penalties if you are doing business with excluded. Even if you say that the exclusion was accidental, but still the fines can add up quickly, and it is you will undergo this enforcement action if even if it is accidental. And if the severe cases involving this fraud or intentional misconduct, and if you are employed them, then it can even warrant for criminal charges. Beyond formal penalties, there could be non-compliance which can damage the organization's reputation, right? Not just, we are not just talking about the money value, but it also damages your reputation, branding, right? So you will lose the trust from your patient, partners, and even regulators can have long-term impact on this. And ultimately there could be also chances that the organization itself can get into that exclusion list because of the too many non-compliance. So if that happens, then it will shut down your entire services lines and result in massive financial losses, right? So overall, I would say these consequences are showing why regular screening and strong compliance practices are not optional, but they are very essential in protecting your organization. Next slide, please. So I just have a small case study which sets the, I mean, it's a quick case study which will show why OIG monitoring is so important. So in this particular case, the hospital had executed a contract with a respiratory therapist, but who was in the OIG exclusion list. But they did not know that this person is in the OIG list, because when they were onboarding, he was not, that person was not part of the list, but over the period of time, they were part of it. So the challenge was mainly it was a manual process, and the screening was used to happen only during initial stages, and there was no continuous monitoring of those. So that's why the action or the result by adopting a new process of automation was immediate detection. It will help with immediate detection and rapid remediation. so that it makes stronger internal controls. I have a quick poll. I think since we don't have much time, I would just read through the poll, and I assume that these are
which
the
capability would add most value to your compliance program? So it would be automated OIG, real-time alerts, or active exclusions, centralized for active exclusion, centralized workforce and vendor monitoring, and audit-ready documentation and reporting. But actually, it is all of them, right? So if you go to the next slide, we have a contract management system which has all of these features in it. So we can go to the next slide, please. So it has the OIG validation where it automates the screening of the employees, contractors, and vendors. It also does vendor management where it centralizes the vendor records. It tracks the onboarding also and the screening status, as the previous speaker was mentioning, that the screening status has to be an ongoing process because every year this list keeps getting updated. Actually, I shouldn't say every year, but as we speak, it gets updated. And also compliance monitoring, where it also has alerts and monthly reminders and audit-ready reports. So if you go to the next slide, you would also see that HealthDocs has a complete suite of GRC solutions, including contract management as one of them. And all of these are having interoperability. So if you're ready to integrate AI, which you use for your daily actions like either Copilot or ChatGPT, we also have the AI assist features that can help you and help the organization improve in their compliance. So if you go to the next slide, the presenter will go over the resources that you have.
Here are some of the OIG resources for you. The exclusion program, the first link gives the details about exclusion program, and the second link is about LEIE, that is list of excluded individuals or entities. It's a downloadable database you can download, and there are supplemental downloads also, which is the third link. And more importantly, if you see any non-compliances, or if you come across such cases, you can do the self-disclosure at this self-disclosure protocol link on the fourth one.
Great,
thank you.
So in the chat window, we have one question. So maybe we can go ahead quickly with the question. So the question was on, do organizations need to screen both employees and contracted vendors, or only those who provide direct patient care?
Okay, that's a good question. The organization needs to screen everybody, not just the one whom, I mean, it is not necessary that they should only screen their doctors or even the just the vendors. But even if it is administrators or anybody, all the employees, contractors, vendors, anyone, if you think they are working with you and providing services, if you are participating in any federal programs, then you need to screen them against this.
Great, thank you. Hey, thank you all for joining. We will be available for any questions through email as well. You can respond to the email that you have received the invitation on. So happy Thanksgiving and Happy New Year. And thanks, Rupa, for the presentation. Have a great day.
Thank you all. Have a great day.
Thanks. Bye.